My story starts long before I found PRMA. My great-grandmother, my grandmother, and my mother all had breast cancer. So I came from a family that was very knowledgeable about what was happening and what our chances were of having cancer. My mother tried to take her life into her own hands when she asked for a prophylactic mastectomy. The doctors told her it was too radical, it wasn't being done at the time, and that she would be fine. In 1989, my mom went in for a routine mammogram and she was diagnosed with breast cancer. In 1991, we lost her. It was a short, hard battle, and I was 13. And at that point, you don't quite understand what's happening, but you know it's something serious enough that you need to take charge. In 2004, I had my first child, and it was at that moment that I realized I need to do everything I can to stay around as long as I can. So in 2005, I had the BRCA1 test, and it came out positive. And at that moment, I think I knew it would be positive, but at the same time, there was sadness and a little bit of shock. As I sat with the genetic counselor, we discussed options that I had available to me that my mother did not have. And those options were reconstructive surgery, doing prophylactic mastectomy. I was offered one step with alloderm, using implants, and I was offered DIEP flap. And back then, after having my first child, I thought the DIEP flap sounded wonderful. I could get rid of that baby belly that I'd worked so hard to try to get rid of and couldn't. However, as we were thinking about surgery, I became pregnant again, and I had my daughter, and then I became pregnant again. So there was never a good time or right time for me to go through with the surgery. In 2010, we relocated overseas to the United Arab Emirates, and at that point I was finding a whole new team of doctors to help me. It wasn't easy, and I felt like I was being bounced around because there it wasn't routine, and they weren't as up to date as what I had been receiving back in the States. So I started researching how to do this. I was far away overseas and I couldn't walk into doctors' offices to have consults. I contacted a few offices directly via email. I was asking questions, simple questions I thought, about the surgeries, about traveling overseas, about whether or not they could talk to me via Skype. And I was surprised how many doctor offices said no. They wouldn't have anything to do with talking to me via Skype unless I was sitting in their office first. I couldn't fly overseas just for a consult. It was a Facebook group that led me to a very special group of women who highly recommended PRMA. And in doing my research, I found that these women felt secure, they felt a sense of peace, and they had one thing in common, and that was Dr. C. I went and looked at the website, I looked at the before and after pictures, I read the patient testimonials, and I even contacted Courtney, the patient liaison at PRMA, and asked her what my options were. I filled out the online form, I sent my photos in, and I was told I was a good candidate for the one step with alloderm. I started getting my hopes up. I was getting excited that this was going to happen, and we were moving forward, but then we got the news that we were being relocated. So again, I was moving overseas and ended up in Singapore. So I put the surgery off again, and in November 2014, on Thanksgiving Day, I went in for a routine mammogram. And this was the first time that my mammogram was not routine. Every time I go in, every 6 months, I hold my breath, my husband holds his breath, and we wonder if this is the time that I'll be told that I have cancer. I went in for the second mammogram and ultrasound, and they asked me to immediately go to the oncologist to discuss the results. And sitting in the meeting with the oncologist was the most cold feeling I had ever had. She didn't want to hear my history, my stories, my concerns, my worries. She wanted to talk to me about her research, show me her data, and basically told me she wasn't going to do a prophylactic mastectomy. If and when I got cancer, she would cut it out and we would then treat with radiation or chemotherapy. That wasn't okay with me. I didn't want to get cancer, and I don't feel that she truly understood that. Leaving her office, I realized that I couldn't put this off anymore, so I moved into fast forward motion. Between December and January, I made connections again with my Facebook forum and all the ladies who had been willing to share their stories with me. They not only shared stories with me, they shared their photos with me. It wasn't just the PRMA website before and after photos. I was seeing photos of women with their own cell phones. And that meant a lot to me. So I made my connections again. I asked them all my questions I had. I again researched other surgeons just to make sure I did my due diligence, and I ran into the same thing. No one would talk to me. I was too far away. I was 9,000 miles away, and they couldn't evaluate me. So I contacted Courtney again at PRMA, and we got the ball rolling. I was filling out the forms for insurance, and she was submitting and getting prior approval. We set up a Skype consult with Dr. C for February, and I sat right here where I am right now, talking to him via Skype with my husband by my side. And I remember turning to my husband several times during the interview and smiling, and it was the biggest smile because someone was listening to me and someone heard my concerns, someone understood my fears. And no matter how many times he's heard this story before or sat across from a woman like me, he made me feel like I was the only one at that point. I was his concern. He was there to help me. Immediately after the Skype consult, Courtney submitted my papers officially to insurance, and it took 5.5 weeks for approval. And as soon as we got the email for approval, we booked our tickets. We were going to San Antonio to PRMA, and Dr. C would be doing my surgery. I had 5 months to wait though. And in those 5 months, you wonder, what if I'm waiting too long? What if I left a window open and we have surgery and I have developed cancer in the meantime? It was a risk I had to take. There's a lot that goes into traveling overseas, and I have to say that Courtney was instrumental in helping this whole process happen. She was there for me every email I sent. Sure, she was going to drop me. Sure, she was talking to other nurses in the office saying, oh my goodness, we have a type A OCD patient on our hands. But I had a lot of questions, and I couldn't just pick up the phone because of office hours being different than my waking hours. So any email I sent, she was quick to respond, and she assured me that there were no dumb questions. And again, I felt reassured that I had made the right choice. In the same time frame, I was also connected with Denise, who is Dr. C's nurse. And I'm sure Denise felt like Courtney. I had a lot of questions, and she never made me feel like I was taking up too much time. And maybe I was, but she didn't let me know. Denise was very, very supportive. And I remember hearing her voice for the first time on our phone consult, preparing me for surgery and traveling. And it was just that feeling that we had made the connection finally. And I was so thankful to her for taking that time and working around my hours. Them staying late in the office, knowing that I'm waking up very early here and we're going to make this work, means a lot. And Dr. C staying after office hours to Skype with me so that we can be in a decent time zone lets you know that you're a priority. We flew to San Antonio on June 9th, And I walked through PRMA's doors, and a sense of relief came over me. And I think I was both smiling and welling up with tears. I was happy that this was finally happening and that such an amazing group of people was helping me make it happen. While we were waiting, my son needed to use the restroom. So I took him into the back, and I was waiting in the hallway for him. Dr. C came around the corner, walking down the hallway going to another patient. He glanced at me, said hi, I said hi, and he kept walking, but then stopped in his tracks, turned around and said, "I know you." And he immediately came over and gave me a hug and asked how I was. And I couldn't believe that my doctor, who I'd only Skyped with once, recognized me in person right away. And I couldn't believe that he was so warm and welcoming and just there in that moment. We went in for the consult, and he took his time drawing picture after picture, making sure I fully understood what was happening. He's a detailed person. I would say he's as much as a perfectionist as I am. And he not only wants to do his best in eradicating the breast tissue, he wants to make sure you feel beautiful when you come out. He wants to make sure that he places the scars in the right place. He wants to make sure that he chooses the right sizes for you. He wants you to be realistic. He takes his time, and I really appreciated that. And he took so much time that when we came out of that consult, the front office was closed. The doors were locked, the lights were off, and everyone had gone home. I'm used to being rushed out of meetings, consults, doctor's visits. And not once did they look at their watches. Not once did they worry about what was happening outside the door. Denise and Dr. C were there in the present for my husband and I. And when we came out, the only person who had stayed was Courtney. And as a patient liaison, I can't speak highly enough of her. The fact that she stayed behind to meet me in person, put a face and a voice to a name that we had only chatted via email and Facebook previously, meant a lot. Everyone had done exactly what I would always hope for, but never thought I would get. 2 days later, on June 11th, I had my surgery, and it was as if they had taken every vibe and special feeling you get from PRMA and put it into the hospital. They've obviously chosen the hospital carefully and the staff carefully and believed in them to continue that special care you get with the PRMA staff. Everyone was helpful, they were warm, they were funny, they had a way of putting you at ease, and for someone who is terribly afraid of hospitals, I felt good. There wasn't a moment I was in there where I cried before surgery. There wasn't a moment where I was freaking out. I was able to laugh with my husband. We were taking pictures. We were joking with the nurses. It was a great environment. Dr. C came in and he marked me up, and we went into surgery. Waking up in my room, I remember the surgical nurse came in and she told me that I had had a really fun time in the OR before going under. I don't remember any of it, but she said I was talking to everybody, saying hello, and I was amazed with the surgical lights overhead, and I kept telling them how beautiful they were. And she made a point to come into my room and tell me the story. And I thought that was really special, that she would take the time to come see me afterwards and share a bit of joy that she had at my expense. The nurses who took care of me were wonderful. I had pain, I had discomfort, but it was not near what I'd expected. I think I had built up this whole scenario after surgery, and it never happened. I was made comfortable. I was taken care of, and I asked my husband for my phone a couple hours after waking up so that I could start tweeting and Facebook updating. And within the next 12 hours, I was blogging. And Dr. C came to visit me. Courtney came to visit me. And Dr. C even called that night and talked to the nurses to check on me, see how I was doing. The reason that's so important is because I later found out it was his birthday. So not only was he doing surgery on me on his birthday, he was taking the time out that night to call me and check on me. And that meant a lot. And I, to this day, say I can't thank you enough for everything you've done. My recovery has been textbook. I was up walking around the Riverwalk 2 weeks later. We were having lunch. My drains were out. And at 14 days, I was discharged and told I was okay to go home. And I can't tell you how amazing I feel. I look in the mirror now and I feel no fear. I don't have reminders of when is the cancer going to come. I feel beautiful. My breasts look beautiful. I couldn't have asked for anything better. And the greatest part is that Denise, Courtney, and Dr. C are still in my life. We still talk. And I feel like we're forever bonded by this experience. I wouldn't hesitate to recommend PRMA to any woman looking to go through breast reconstruction. I definitely would not hesitate to recommend long distance travel. I traveled 9,000 miles to do this. I would do it again. PRMA makes it very, very easy to do. Courtney handles everything. There's a wealth of resources on the website, and it's no different, in my opinion, than driving to the next city. That's how easy it was. So I would definitely like to plead to women who are worried about traveling, don't worry, just do it. You will be in the best of hands, and they will make sure that you get through this journey the best way possible.